The aim of medicine is to diagnose and treat disease and thereby prolong life, but the ideal of medicine is to eliminate the need of a physician. The seeds of virtually every disease that any of you could suffer from in the future are sown in very early life, and if we can understand that, then we can intervene early and prevent these problems ever occurring in the first place. And certainly the seeds of the other themes, frailty and breathlessness, are clearly sown in early life.
As we stand now, of course, frailty is a key issue, not just in northwest London, but across the world. And I think we know that, for instance, the age is a key risk for frailty. And there's nothing we can do about aging, but can we do things about the consequences of aging? Frailty isn't just a medical condition. It's the interaction between the person, their mental health, their physical health, and the society they live in. We can look at working in the community to improve lifestyle, to improve diet, to improve those drivers for what makes a person develop the medical conditions, which may then lead on to frailty. But also one of the things that we're really keen to explore is resilience. Can we actually make people more resilient, make their environments more resilient to prevent the onset of frailty?
So through CLAHRC 1, we realised that many patients had breathlessness. We know that breathlessness is very frightening to patients, and many patients live in the community with their breathlessness, and many come to hospital because they are scared by their breathlessness. The main conditions associated with breathlessness are chronic obstructive pulmonary disease, heart failure, and then anxiety and obesity can also lead to shortness of breath. So we really want to ensure that care is prioritised to these patients and that care pathways are smoother across North West London and that management delivery is bettered.
So this theme is basically, it is about the approach that's taken to closing that translational gap, the gap between evidence and practice, having sort of the right methods and tools to enable you to deal with the complexity and the challenges that will throw up probably over a 2-year period. Many of those complexities are just things that you won't be able to anticipate. So it's about having a gradual approach, an iterative approach to putting evidence into practice, being able to measure, being able to respond to it, being able to take small steps rather than jumping straight in. So that's partly about enabling projects to do that, but also to study the process by which this is done.
Our overall aim really is to enable patients and families to be involved in research and quality improvement so that any changes that are made to treatment, care and processes are responsive to their needs and preferences. And also we're revisiting about how we connect with individuals and people in the local community so that they can get involved in the overall programme. We're used to having conversations in clinical consultations, but we're not very good at having conversations about what people might need. They want to help themselves and we need to move in that direction too to support that.
If we neglect mental and physical health needs, they have a huge impact on each other. We know that people, for example, who experience breathlessness also experience anxiety and depression, and that there's an interplay between the two. We are planning to work across all the other delivery themes, and we can start supporting people to start integrating this into their work. If we neglect the physical health care needs of people with severe and enduring mental health problems, that this will have a massively negative impact on people's life expectancy.
The Public Health and Information Intelligence theme is here to support the delivery projects to achieve long-term success, whether that's in better understanding the population needs and health needs of the patients who live in North West London and beyond, whether it's in the design, implementation and evaluation of interventions, evidence-based interventions to improve patient care and health. The theme will bring the expertise in data analysis and statistics to support you in your work in the delivery theme projects.
Well, collaborative learning and partnerships theme is really, it's about you. It's about connecting people, bringing people together, sharing learning. We're also interested in really helping to support you to build capacity, whether you're staff or patient, and any of our partners, to come along to events like this. But also there are other opportunities where you can get involved with a leadership improvement fellowship. So there's a whole range of opportunities where we can help build capacity and support you to lead improvement initiatives and make a real change on the ground. ground, and that's what we're about.